Guys, was this on your 2025 bingo? This was definitely not on mine. Apparently, blue state governors are rolling back health care for undocumented immigrants. Depending on the states, it'll basically be loud and clear why they're doing it. I think the most important are probably going to be California, Illinois specifically. These are the ones who need to fix a good amount of these things, and obviously New York also, but probably more so California along with Illinois. But either way, let's go and jump into it. Oh, guys, if you guys are new here, please like and subscribe.
Of Democrat-led states facing budget crises are moving to cut health care funding for illegal immigrants. The progressive governors of California, Illinois, and Minnesota, they are moving to roll back or freeze programs that extended state-funded health care to people who entered the country illegally, citing rising costs and unexpectedly high enrollment. And Washington, D.C. Mayor Muriel Bowser is looking to follow suit as well. News Nation's Mills Hayes is following this one for us. Mills, this is interesting. I mean, is this strictly about cutting budgets, or is this a sign that Americans don't want to pay to take care of people who are here illegally?
For them, it's just budget.
Good morning to you, Marky. We have seen Americans change their opinions about undocumented immigrants and getting health care. A lot of it having to do with the decline in the threat of COVID-19. And we have seen federal funding for COVID relief. That has ended, along with states' actual spending being much higher than their projected spending. So it's leading many governors to roll back that health care coverage for undocumented immigrants. And we're seeing this over in California. Governor Gavin Newsom now wanting to freeze new enrollment in Medi-Cal for undocumented adults. Existing patients can stay, but even they could see benefit cuts. It's exactly what Republicans like California Assemblyman Carl DeMaio have been calling for.
Yeah, guys, it's incredibly important, specifically that that California starts working on Medi-Cal. In fact, listen, I get it. You know, their problem is their problem because they kind of want this problem. But I'm definitely against the concept of people utilizing a system that they have never themselves put money into, if that makes any sense here. I don't think that these individuals should be deserving of this type of system because, again, in their country, they wouldn't have it.
We simply cannot afford it. And it's certainly not just to put the health coverage of poor Californians, elderly, disabled, young children at risk because California politicians want to give free handouts to people who are not even citizens.
Here in Illinois, Governor J.B. Pritzker taking it
guys,
even
you wonder why things
further.
are so expensive in California? The taxes? This is why.
Ending the immigrant adult health program entirely on July 1st. It launched back in 2021 and currently covers over 30,000 people. And Minnesota, they are also pulling back, kicking undocumented adults off of Minnesota care by the end of the year. And in fact, the top Democrat in the House, Minnesota State House, Melissa Hortman, she was murdered this past weekend in what Governor Walz has called a politically motivated assassination. And she was the only Democrat to side with Republicans at the end of their legislative session just last week. She sided with Republicans to get rid of health care coverage for undocumented.
Yeah, so it sounds like we definitely need to look pretty heavily into that scenario. I heard nothing of it, and you guys send me everything.
Immigrants in order for there to not be a government shutdown. Now, pundits say that it's not the governor's values that have changed, but cash flow. All three states are facing budget shortfalls, and there's new pressure coming from Washington.
Oh, that's a surprise.
Including a federal bill that would cut funding to states covering undocumented immigrants. And the cutbacks have sparked outrage from immigrant rights groups. They say that it's a step backward for public health and for states that claim to be inclusive. And more states could follow suit because right now open enrollment rules are now under review in Colorado, Washington, and also New York, Marky.
Wow. Okay. All right. Healthcare is a human right, the sign says here. Well, listen, I'm definitely down for that type of thing. And again, guys, when it comes down to politics and political stuff, I'm absolutely fiscally conservative. I know that factually. When it comes down to social type of stuff, I'm a little all over the place, guys, okay? Absolutely all over the place with that. I have no problem telling you that. I am more of an independent than any other thing that you can imagine here. Again, pretty much due to me being socially kind of all over the place when it comes to these things. But now, when it comes down to healthcare, I do know that if we can stop allowing countries that are making pharmaceuticals to completely price gouge us, Okay, or if we can cap things, put a cap on things like how other countries do around the world, we could fix a gigantic amount of problems in our healthcare. Right? If you want to fix the budget in one day, stop allowing emergency rooms to charge you $15,000 for basically being for them to basically put like a stethoscope to your chest, guys. All right, we need to fix a lot of things with our healthcare. Yes, it's expensive. Should it be? No. I'm sorry. Guys, it shouldn't be. But I also don't think that every single person that comes from outside of the United States of America should be able to utilize our system and get it for free when there are people who do not even have health care in the United States of America. How is that a thing? Okay, just understand that for a second here. If there are people who are working, but because they make, I don't know, $10 over the limit, let's say, these individuals do not have any type of health care, any type of insurance, because they cannot afford the insurance. Just like the people who are making $10 less, right? The two groups could not afford the insurance. You want to fix this, we need to have a larger conversation about healthcare. All right, we have a problem. We have a serious problem. When, I don't know, the last time I went to the dentist, I got charged like $1,000, like an emergency tooth removal. Right? And then in Spain, where I live half the year, it was like $50 for the same exact thing. Guys, we have a problem, okay? And I'm talking about the same level of cleanliness, the same level of aftercare, the same level of care, right? The same level of numbing agents used, okay? I felt nothing in both places, but one was almost $1,000 and the other one was $50. So how can we quantify this here, guys? Okay, we have a problem with our healthcare. I do think that if we can kind of wrangle it in like all these other countries have done and not allowed, all these gigantic companies to come in and sell their product for 1,000% more than they sell it in their country. Okay, what about, can we fix that? Let's say that. Can we fix that? If we can just fix that, then we can 100% fix our healthcare, I think personally. Okay. We should not be, for example, it's so expensive. Healthcare is so expensive that in the United States of America, that if something happened to the average person, that person is not going to go to the hospital because they know they're going to get like a $50,000 bill. Okay. They know that. So these people are risking the small things that could be caught immediately while they're cheaper. Okay. For the big, gigantic thing at the end of the road where now things are kind of off the rails when they should have went and seen a doctor 3 years ago for something. Okay, all because of our healthcare system. We have people waiting, okay, lying in wait, basically, for something terrible to happen and before they actually go to the hospital because they know that it's going to be a family destroyer for them to see the doctor for one day. Okay, we have a problem. I get it. There are going to be people, how dare you say, you want everyone to have health care. Guys, listen. Again, if something happened, I will go to the airport, okay, and I will take an immediate flight, the next flight to Spain, and go to the doctors there. I would rather do that, and it'll be cheaper by 100% for the same level of care. South of Spain has a gigantic amount of medical tourists for a reason, guys. Okay, I'm telling you, medical tourism is a real thing. Dentistry, vision, all of these things, plastic surgery, guys, all of these things. I don't care. I'm not gonna give a hospital $300,000 to fix a problem that Spain will fix for 1,000, if that. Okay, sorry, I'm not doing it. But listen, guys, let me know in the comments what you guys think. I do think that finally sanctuary cities are kind of coming along here, and they're starting to say that maybe we should stop doing this because there's a gigantic swath of Americans who absolutely have a problem with people utilizing systems they're not paying into. Okay, I get it. You want to have the argument, but they work illegally. They're working illegally. I'm supposed to feel something for that, bro? What are you talking about? They're working illegally and then they're buying things locally. That's local government. I'm not talking about that. Okay, they're not benefiting the federal system, are they? If they're not, then that's not the conversation. And I already smell the comments, guys. All right. But listen, you guys all have an absolutely amazing day. Enjoy your day thoroughly. And again, if you guys are new here, please like and subscribe. All right. I'll catch you guys later.